Welcome to today's podcast. I am James Cork, one of the lead physios here in Mayfair Health, and I'm here with Sam. Sam, can you introduce yourself?
Yes, hi, I'm Sam Charles. I'm also a lead physio here at Mayfair Health, and I'm the one running the bone health clinic.
To start off with, we know that there's sort of a growing concern in terms of people thinking about their bone health at the moment. Has there been a rise of osteoporosis, or what's been happening?
It's a great question. I think it's a concern that is growing, that needs to be growing. This is something that we've known about for not a very long time, how prevalent osteoporosis is. It was always seen as an old person's disease. We'll see it as something you can't change. Death and taxes and osteoporosis is what was seen to be the case. So it's not that there is an increase in osteoporosis, there is an increase in people being aware that they have osteoporosis. This is known as a silent killer, which means that there's so many people out there that have osteoporosis, and it's only once they have a fall and have a subsequent fracture, that's when they actually find out that they have osteoporosis. So I think it's very good that it is becoming a growing concern, because this is something that without getting diagnosis and without education is something that would have continued to perpetuate without really any change. And so what we're seeing now is people becoming more aware of it, which is only a good thing.
Yeah, and I think on that note, I've been seeing quite a lot more sort of bone stress injuries in the clinic from younger population as well. I think there's a growing popularity in running and endurance sports worldwide. So I think there might be people picking up these injuries a bit more as well, and we'll dive a bit more into that. There are loads of aspects that I think can impact bone health, and what do you think those are?
So there's a huge amount of aspects and factors that contribute to bone health. Some of these are modifiable, which we'll touch on, but the non-modifiable ones, and what does play a large role that we can't ignore, is genetics. So family history, be it whether your parents or your grandparents had osteoporosis, whether they knew it or not is another thing. And if they've had fractures from osteoporosis, we know that about 60 to 70% of your bone mineral density and your bone mass is dictated by your genes, and that is coming through obviously your family history. So unfortunately we can't modify that. Sex, and whether you're a man or a woman, that has a large impact on your bone health. And then if we're looking at some of the other things that we can modify, which is a bit more exciting because we can do something about them, sleep is a really important one. So sleep, we know, is so important in the recovery and the formation of new bones. So regardless of how well you are going about helping to try and produce more bone, if you're not recovering well, then we're not going to see the benefits of those occurring. There is a study that I really like which showed that individuals who got less than 6 hours sleep or poor quality sleep have reduced bone turnover markers when they measured their blood, which meant that regardless of whether they were doing all the right things that we'll speak about later to improve their bones, if they're not getting adequate, good quality duration and consistency with their sleep, they're not actually going to get the benefits of that. So sleep is super important, and one thing we really want to address early.
And sometimes I think we overlook the foundation or the bread and butter of recovery, which is the diet and sleep. And
exactly.
On the topic of diet, what role does it play in bone health?
So diet is also super important. There are so many things we can do to help our bones, but as you said before, sleep and diet are really the foundations of getting this right. And it basically provides a framework for us to get the benefit out of our bones through things that we'll talk about, such as strength training later on. Diet, we're looking at two main factors when it comes to bone health, being vitamin D and calcium. Vitamin D mostly derived from the sun, some from food, some from supplementation, and calcium is mostly derived from food and as well as supplementation too. So a way I like to think about it is, if you are trying to build new bone, think of vitamin D as a courier and the calcium as the package it's trying to deliver. So without vitamin D, we don't have a driver. We can't get the calcium from our bloodstream into the bones to form new bone. And then without calcium, the driver's driving around with their packages to deliver. So when we're looking at diet from that perspective, we want to make sure that we're getting adequate calcium. So that can be from good quality dairy such as yogurt, cheese, milk. You can get it from other sources as well, but those are sort of the main areas that you want. You can also look at supplementation, but that's something we're discussing with the GP because there are cardiac implications. And then vitamin D, we want to get from the sun now. I'm from Australia. I get a lot of sun back home, but here not so much, especially when we're in the cold, dark months of January. So you want to be first seeing if you can get a blood test to see what your level of vitamin D is like. Then you also want to be seeing, well, do I need supplementation? Most of the time when you're living in the UK or in the Northern Hemisphere, the answer is yes. Just because in our day-to-day lives we're often indoors, and even if we are outdoors, we're not getting adequate amounts of vitamin D to help provide more drivers on the ground to take and transport that calcium into our bones. So that's also something that's really important from those two perspectives. When you're looking then at overall diet, protein intake is super important, not because it necessarily impacts the bones from a primary sense, but if you have good protein intake and you're applying that with good training, then you're going to see increases in muscle volume and mass, which is going to help you lift heavier weights. That's going to help introduce mechanical strain on the bone. If you're not taking good quality protein, then you're not getting increases in muscle strength. You're not able to train as well as you might be able to, or recover as well as you might well be able to. And then with that also comes caloric intake. So how much are you consuming? What we would see, unfortunately, with younger people, and you touched on before, with adolescents and people who are doing ultra endurance activities, getting bone stress injuries, this is often a case of energy deficiency. They are doing so much training, they've got such a high volume of work that their body is in an energy deficit because they're burning more calories than they're consuming. That leads to weight loss. In women, it leads to poor menstrual cycles, which has a devastating effect on estrogen, which is really important for bones. And what it also does is it means that if you're not consuming enough calories to supplement the work that you're doing, we don't have the metabolic output to be able to get our bones forming again. The body will choose to prioritize areas that it needs to stay alive, and unfortunately the bones aren't one of them from a primary sense to keep us moving and functioning. So we need to make sure that if you are training or just for general life, you are consuming an adequate amount of calories. So working with a dietitian or nutritionist is also really important.
Yeah, I think I always use the analogy of, even though you have a Ferrari, you'll need to fuel it up. So
yes.
Without fuel, the Ferrari can't go far. So
exactly right.
You definitely want to fuel that body.
Yes.
And you mentioned about the difference in sex affecting their bone health. We know that women are disproportionately affected by that. Can you explain why?
So there's a few reasons as to why women are more impacted than men are, unfortunately, when it comes to bone health. The probably biggest thing that we see this occurring in is with the menopause. So around the time of 45, 55, as everyone knows, you will get menopause if you're a female, and what will happen is you get a massive plummet in your estrogen levels. Now, I touched on estrogen before. That is a super important hormone that comes with the formation of bone, and also it helps reduce the resorption of bone. So if you imagine a bathtub, for example, filling up with water and also equally draining out water at the same time, if the amount of water going in, which is the formation of new bone, and the amount of water going out, which is the taking away of old bone, is remaining the same, then the bathtub will stay the same level of water, i.e. your bone mineral density will remain unchanged and it will maintain. That's what we're aiming for a lot of the time, is to have a balance of old bone being taken away, which is beneficial because that is bone that is no longer serving us as well, and new bone, which is going to be stronger, being laid down. Estrogen helps reduce how much water is coming out of the tub. It helps reduce how much resorption is occurring. So when you have menopause, what happens is you get a drop in estrogen. It means that there might be the same amount of new bone being laid down, but there is a disproportionately greater amount of old bone being taken away. So you get a net loss of water in the tub, and therefore a net loss in your bone mineral density, which is why we see that men and women, there will be a slight discrepancy where women will have a lower peak bone mass, and therefore they'll have lower bone mineral density compared to their male counterparts. But around the time of menopause, men don't have this, but women do. You see a massive sharp decline, so therefore the gap widens between men and women on where they are on the sliding scale of osteoporosis to normal bone mineral density. Pregnancy is a tricky one because there is so much stuff happening. You do get an increase in body mass just because you've got another person growing inside you, which actually can be beneficial in terms of your bone health. But due to the hormones occurring in pregnancy, you do also get a drop in bone mineral density as well because of that occurring. Men also see this too. They will get a drop in estradiol, which is the male version of estrogen that is converted from testosterone. This doesn't occur at such a sharp decline around that middle age where you do get the menopause in women, but it does also occur in men as well. So what we're looking for is to not just target women with this, we also want to make sure we're targeting men, especially ultra endurance athletes and men who maybe have also led sedentary lifestyles too. But yes, as you touched on before, women definitely are more affected by bone health, and therefore we want to be targeting these interventions to women as well as men, but mostly getting women early before they reach that stage of menopause when you can really do a lot about it.
There's a growing trend with people taking weight loss drugs like Ozempic. I think we see a lot of celebrities starting to take that and causing a lot of younger population to follow along. Does that affect our bone health?
So it definitely has an indirect effect on our bone health. Ozempic is an amazing drug that can help people who are overweight or obese, who have significant health problems occurring with that. So I think Ozempic is really blowing up, and it can have some really great benefits. But what we're seeing is, as you mentioned, celebrities or young people who are within a healthy weight range, or who have potentially eating disorders or mental health disorders that lead to them wanting to look a certain way or be skinnier. Social media, we can talk about forever, has a really detrimental impact on body image, and that's not the purpose of today's podcast. But what we're seeing is individuals who not only are healthy but also those who are overweight. Yes, you're going to be losing weight and body mass, which for some people is the goal of the Ozempic. But the problem is not only are you losing fat, but you're also losing muscle mass and bone mass. And so you're getting a total loss of mass across all these different tissues that, while it might achieve the outcome of reducing weight, and in people who are unhealthy and need this to reduce their risk of significant health disorders, can be very beneficial. We need to take into account that we're also at very high risks of sarcopenia and osteopenia, where you get a loss of the mineral density of bones and you get a loss of the strength in the functional cross-sectional area of muscle. Both can lead to not only osteoporosis, but also falls risk because they're not as strong, and a reduced activity, which again carries with it a lot of significant health adverse effects. So we really need to be careful, and clinicians and physicians who are prescribing Ozempic need to have a very stern discussion with patients about the risk that they're going to be indulging in when taking this drug, especially if it's not clinically indicated by having a very high BMI.
I think that often refer to this bone disease as a silent condition, because sometimes you won't know that you've got bone disease until you fall and end up with a fracture.
Yeah.
Are there any signs where you can pick up on earlier in your younger days?
So you're exactly right. It is a silent disease, and it's something that for the longest time has only been really investigated or looked at closely by the medical community when you do have a fall and have a fracture, and then everyone goes, oh no, we've got osteoporosis, you now cannot move, or you need to be very careful of falls. And it really can be quite a burden on people, because there's social withdrawal that occurs, and people are afraid to move, they're afraid to exercise, and you take away a lot of life satisfaction. Professor Belinda Beck, who does a lot of research in Australia around bone health, describes this as a childhood condition, which might seem a bit paradoxical because children aren't typically thought of the ones who are burdened by osteoporosis. And what she means by it, and what I think is a really good point to make, is that in children you are not going to be dealing with the effects of osteoporosis, but that is when you can have the greatest impact on your peak bone mass. So I like to think of a paper plane, for example. If you're throwing a paper plane and you throw it nice and high, you're going to have a very high peak. It means it's going to take longer for that to hit the ground. So when you're in your 20s, you reach your peak bone mass in females around early 20s and men around mid 20s. You want to, in your childhood and adolescence, be growing and increasing your peak bone mass as high as you possibly can, so that that paper plane goes as high as possible. Therefore, that means that as it goes down, which we know it will eventually go down, we want to try and either reduce the rate of decline, so therefore we plateau or maintain our bone mineral density for as long as we can into our 70s, 80s and 90s. But we also want to make sure that we're reaching as high a point as possible so that it takes longer for us to decline into osteopenia and therefore osteoporosis. So if we're starting at a very low point where that paper plane is not going very high because as a child we're sedentary, we weren't engaging in physical activity, whether it be weight bearing, training or sport, or we engage in activity on the other side where we were doing lots and lots of training, ultra endurance activities, especially in women as we spoke about, poor menstrual health, then we're seeing that peak bone mass be gradually reduced so that when you reach what should be your peak, you're already at a deficit, and therefore it is quicker for you to descend into osteopenia and osteoporosis compared to someone else who engage in activities that help promote their bone health. So I know you engaged in a lot of football when you were younger. I did a little bit of football, but in Australia we call it Aussie rules. These are great sports because they're multi-directional, so you're getting multiple different angles of strain on the bone, which is really good and important because torsion and bending moments on bone help promote bone growth. It's also going to help weight bearing. So the more weight bearing we have, either our own body weight or increased body weights through weight training, is really essential to try and increase that peak bone mass as much as we possibly can, so that again we have a reduced risk of osteoporosis in later life, because we were able to get the best out of ourselves when we were children. So for parents hearing this, the simple advice is get your children outdoors, get them exercising, get them active, get them engaging in sport, multi-directional and team sport. That's probably the best thing that you can do, in addition to the things we spoke about, such as sleep and diet as well.
I think when you're young, you can increase your peak bone mass, but also the quality and the girth of the bones as well. That's something that we can't regain further down the line. You touched on exercises earlier. There are many forms of exercises. There's running, multi-directional exercises like football, rugby. There's weight training, gymnastic, things like that require a bit more jumping, plyometric exercises. Is there a best form of exercise for bones?
Yes, you're exactly right. There is a best form. Often something is better than nothing, and so doing anything is better than being sedentary. But what we want to prioritize when it comes to exercise is two things. It's diversity of movement, and it's also increased weight bearing. So some sports that are fantastic, as we mentioned, football, tennis, gymnastics, basketball, things where you're jumping, hopping, landing, you're getting large amounts of force going through the bones because of the change of direction, because of the impact of when you're hitting the ground, and also because of the sprinting and the soft start nature of these sports. Other sports that probably are not great for bones doesn't mean they're not bad sports. They're fantastic for so many reasons, and I know you're training for the London Marathon. I've been doing a little bit of running myself. Running, swimming and cycling, these forms of ultra endurance activities often can have either a net neutral when it comes to bone health, or a net negative. And so if we're looking at younger people, if you're engaging in these ultra endurance activities and you're not getting adequate calorie intake, you're not supplementing with vitamin D or calcium, and you're potentially getting poor mental health occurring with this. This is where stress fractures can occur. And there was a study done in Stanford a number of years ago where they looked at an observational study of peak bone mass and of bone mineral density for varsity athletes versus sedentary classmates. And so what they looked at was runners, cyclists, swimmers, gymnasts, and just normal people. And so what they found was if you have sedentary people here, which is an average bone mass, which doesn't mean it's good, it just means it's average. You have swimmers being slightly below because they're in a non-weight bearing field, I guess, when they're exercising. You have cyclists being on par with these sedentary people. So these are cyclists that were varsity athletes at Stanford. They're doing very good in their chosen field of sport, but because they're not getting weight bearing or that multi-directional aspect to sport, they're not seeing those improvements that we would see otherwise. Runners are slightly above because it is weight bearing, but it is a single direction sport with not much variety or diversity in terms of the movement. So you're not getting those multitude of different strains that occur to help the bone, increase in diameter and girth as well. And then you have gymnasts being the best. Now, gymnastics is another kettle of fish when it comes to the myriad of other health or orthopedic problems that you get down the line. But in terms of the force and impact and the multi-directional nature of gymnastics, that has huge improvements in terms of the bone health of these athletes as well. So you're totally right. It comes to not only are you doing something, but what are you doing and what is the consistency and the level that you're doing it at.
I think I always think bones get bored.
Yes.
If we do monotonous exercises like running, they don't like it. They just get bored very quickly. So anything that, requires multi-directional movements is good for the bones.
Yeah, for sure.
And we know that strength training has some evidence that it can have a positive impact on bone health. Can you explain a bit more how that works?
Yes, so I was saving the best for last. Strength training is probably the best thing you can do for bones, and that doesn't need to be waiting until you have osteoporosis. That can be at any stage of life, and that is so important, not just for bones, but for muscle health, cardiovascular health, and mental health. If strength training was a pill, and it would be the most widely prescribed pill in the world because of the benefits that you get for so many different things. So when we're speaking specifically about bones, strength training has been shown through research coming out of Australia, I'm not biased just because I'm Australian, to improve bone mineral density over as little as 8 months. Now, there was a study done in Australia on the Gold Coast in 2017 called the Liftmore trial, What they did was they looked at two groups of women who were postmenopausal, who had osteopenia or osteoporosis, and they put one group into the treatment arm, which was 2 sessions a week of 30 minutes of strength training, doing a squat, a deadlift, an overhead press, and a jump on land. So these are compound heavy movements. And then they had the control group who was still doing some exercise, but this is exercise that was consistently deemed as safe by the medical community because it had a low risk of falls. That is balance work, calf raises, bodyweight lunges, some stretching, and some walking. Now that doesn't mean that any of those things are bad, but as we spoke about, there is not enough strain on the body and the bones are getting bored. They're not getting a stimulus that is required for osteogenesis, which is the process of forming new bone, as we see the resorption of bone occurring at the same time. So when it comes to strength training, the evidence is clear that if you do strength training consistently with heavy weights with supervision and with good form, you should see either a maintenance of your bone health, which over time will set you apart from your peers who are going to gradually decline, and you're also going to see potentially an improvement in your bone health and your bone quality as well when it comes to diameter, girth, cross-sectional area, and also the microarchitecture of the bone inside as well.
The advancements in technology are offering a new way of addressing bone health, and we have a machine called the BioDensity Machine. How can that help?
Yeah, so we're very lucky we've got the BioDensity Machine here at Evolution South Kensington, which is a machine that has also been shown in those similar trials that were done in Australia to improve bone mineral density at a similar rate to that of twice a week of strength training. Now, the BioDensity Machine utilised what's called Wolff's Law. So this was discovered by a man called Wolff in 1882. Now what we're seeing is that the BioDensity Machine helps utilise this principle to increase bone mineral density by increasing the mechanical strain on bone, which when done chronically and consistently over time, can see improvements in bone mineral density as the body responds to this load to increase bone formation. So what the BioDensity Machine does and what's so amazing at is it's only a 10-minute session that utilizes 4 different movements, 5 seconds each movement, doing an isometric exercise. So that is similar to what we looked at in the Lift More trial. It is a chest press, a leg press, a vertical lift, and a core pull. Now these 4 exercises, when done well and with supervision, can induce loads 2 to 10 times your body weight, depending on which exercise you're doing, which is load and forces that we just can't see in everyday life, or even with strength training as well, in a population that might never have been to the gym or just can't lift a heavy enough weight to induce those kind of forces. I think with the machine as well, is one thing to add is with strength training, there is a risk. We try and make sure that whenever we're engaging with strength training, we're doing it with supervision and with good form so that we're reducing the chance of that risk. But what we can see with the BioDensity Machine is that we can set you up in biomechanically the best and safest position for you to exert that maximum amount of force without occurring with an injury. So there's been over 1 million sessions there's been over 1 million sessions put on this machine. And what we've seen is that there's no fractures, there's no risk of injury because it is a self-limiting machine. You can push as hard or as little as you want, and there is nothing pushing against you, so it is very safe, and we know that you can get the benefits very quickly compared to strength training, which might take some time to build up your form and technique to get to a level where you're lifting weights heavy enough to have that impact on your bone.
Gosh. So for those who don't know about the bone health, how can they find a diagnosis for that?
Yeah, so the only way we can really look at our bone health is through getting a scan, because osteoporosis or poor bone health doesn't present as signs or symptoms that we feel in the body. And typically the only way that we were going to initially see this was through a DEXA scan. So a DEXA scan gives us a score, which is showing us whether we are normal, osteopenic, or osteoporotic, with a sliding scale and a score that we can get as what's called a T-score. Now, a T-score is derived by comparing your bone mineral density to someone who is young, sex-matched, and race-matched. So for me, it would be comparing myself to someone my age, and it would be a white person who is a male. Now, what we would see is when you are getting a DEXA scan, is it is a full body x-ray that looks at the lumbar spine and the hip as well to compare and see what your bone mineral density is. Now, this will give you that T-score, and if you have a score of -1, it will show that you're osteopenic. If you have a score greater than -2.5, it will show that you're osteoporotic. So obviously, as you get older, as you decline, like we spoke about that paper plane, there will be a greater chance that you're either in the osteoporotic or osteopenic phase because you're comparing yourself to someone who should be in their peak bone mass. Now, this was the only way that we could typically look at assessing someone's bone health and bone quality, through looking at purely the bone mineral density, which often isn't the greatest indicator of what someone's strength or the bone health is actually like. So we've got at Evolution South Kensington, and what we're starting to see now being more broadly spread throughout the UK and the world, is what's called the echocardiogram scan. Now, this is an ultrasound machine that gives you an instant result, which looks at the exact same areas that you would with the DEXA, being your lower spine and your hip. And not only does it give you the bone mineral density scores that has been shown in studies to be very comparable to that of a DEXA scan, but what it does in addition, which is really exciting, is it shows us what the architecture of our bone is like, and it shows us what the quality of our bone is like, which is a greater indicator of fracture risk than bone mineral density alone. You can then put this within a score called your FRAX score, which then gives you a percentage likelihood of a hip fracture within the next 5 years. So what you get here is you get an instant score that you can discuss with your clinician. You don't need a referral for this, so it means that you can book in whenever you like. And also what it does is, because there's no radiation, it means we can get this checked on at regular intervals. Often we recommend between 6 to 12 months to get a check again, because that is how long it takes for these bone health changes to occur with a consistent intervention like the things we've spoken about. And what it means is that we can accurately look at what is the level of bone loss or bone growth like, and what variables do we need to interact with to ensure that we're improving our bone health without waiting 2, 3, 4, 5 years before this can occur.
How long does this whole process take in terms of the test itself, the scanning itself?
So the scan's really quick and simple. You lie on a bed and it's a 30-minute appointment, and so the scan can take between 5 to 10 minutes depending on the probe picking up the signals of your bones. And so what's really good about it is that it will not detect a result or will not give a score if the test is not done properly. So it's really hard to mess up. We have great clinicians that use it here, and there are clinicians that need to be trained to use it. So what they'll do is put an ultrasound probe on. They will get a score generated that will automatically go into a database and give us a result that is not then interpreted by humans, so there's no bias or user error. It gives us the results straight away, and then we can discuss this with our clinician about what it means and what we need to do next.
And is it painful? Is the process
Not
painful?
at all, not at all. The only pain is probably just the cold gel that they have to put on you, but otherwise it is completely pain-free. It's safe because there's no radiation, and it's a quick and effective investigation that we can see is really helping revolutionize the way we diagnose osteoporosis.
And if somebody is listening to this, what are the first steps they should be taking?
So the first steps isn't necessarily to go out and get an echocardiogram scan straight away. I did, for example, because I'm lucky that we've got the equipment and facilities here. But if you are a parent of a child, it's doing things like we spoke about, engaging in sports. If you're someone who is wanting to improve their bone health, it is simply going out there and engaging in a way that you would if you did have osteoporosis. So that is strength training, that is engaging in sport, that is seeking out professionals or clinicians who can help you along this journey. And like I said, there is absolutely no reason why you can't get a bone health scan at 20 years old, at 30 years old, because if we are able to scan early, we can reduce the incidence of osteoporosis. We can be proactive in this disease without waiting until it's too late, and especially we can reduce the risk of fractures. In the UK, there is some 180,000 fractures that occur to the NHS every year that are the result of osteoporosis. And what we unfortunately see is that people who get fractures have a higher mortality after getting a hip fracture, especially if you're older than 65. So I guess when we're summing everything up, there is so much that you can do, and it's never too early to start.
Okay. So to wrap things up, thank you so much for sitting with us today. Bone health is such a major crisis in the society that needs addressing. And especially, like I said before, it's a silent condition. If you got any questions, leave a comment down below or send us an email, and I'll put all the information in the comment section. Thank you for listening.